Hello, Mrs. Vix. Welcome. Today, I'd like to address an issue that I gather has been a cause of concern for you. And it appears you would like to know the difference between hypertension and high blood pressure. And I want to assure you that there's no difference. They actually mean the same thing. Hypertension is a medical term that comes from the Latin language, and the plain English form of saying hypertension is high blood pressure. So hypertension means high blood pressure. So if a doctor uses the word hypertension, you can rest assured that he's talking about high blood pressure. So so no worries about that. Okay, so what is high blood pressure? Uh, so for us to talk about high blood pressure, for us to understand high blood pressure, we need to talk about blood pressure. What is blood pressure? Okay, so blood we know is blood. Is we need the is the liquid in our body that transmits nutrients uh, to all parts. You know, the brain, the heart, the eyes, every single part of our body needs blood to function. Um, so that blood uh, usually goes from the heart, and then afterwards also it goes back to the heart. So the heart is a reservoir from which blood is pumped, and then it has all the blood from all the parts of the body has to go back to the heart in order to get uh, more oxygen, more nutrients. So the heart is really the pump, of the body. So for us to understand blood pressure, which is a function of the heart, so we can compare that to the water system we have in our house or apartment, wherever we happen to live. Usually these days, most people have in-house plumbing. So, and when we open the faucets in our kitchen, our bathroom, wherever we have faucets, um, even in our backyard, like to water the garden, we can tell whether the pressure is high or low or okay, um, by the way we see that water coming out from the faucet. Of course, we don't see. I mean, we can see the pressure um, at which the heart is pumping blood if we cut it, but we don't want to do that. Ordinarily, we don't want to cut ourselves to see blood pumping out of our body. Um, so the heart has to pump blood at a certain pressure. So there's a pressure that is normal, and there's pressure that is not normal. So the abnormal pressure, it could be high, it could be low, but today we're talking about high blood pressure. So um, so usually blood pressure is measured in such a way that we get two figures, right? Two numbers. Like usually when you go to your doctor's office, they show you your blood pressure. They tell you, for example, today your blood pressure, Mrs. Vicks, is 120/80, and they tell you, oh, that's okay. So the number on top, which we call it the top figure, top number, usually indicates the force at which the heart pushes out blood. So the heart is an organ um, made up of muscles, a lot of muscles, um, and so it pushes out. It has to squeeze. We call it contraction. So it contracts to push out blood, and then it has to relax in order to fill up again with blood. So the number at the pressure at which the heart is relaxed um, is the bottom figure. So usually it's not zero. You don't want any of those numbers to be zero. Um, so for an average adult, the number on top, the normal, ranges from 90 to 120, thereabout. There are variations, individual variations, And then the bottom figure, usually the normal, we want it to be, the range is between 60 to 80 is a normal, but sometimes we can say 60 to 89. But between 80 to 89 is kind of, you know, sometimes people say borderline, but we don't use that term again. But it's kind of mildly high. So, the range should be between 60, for the bottom figure, between 60 to 80. But sometimes if someone is at 88, we're not gonna, push medication. We may just advise the person to change certain things in their lifestyle, do more exercise, for example. So anyway, we're not gonna get into all the details about how to maintain normal blood pressure today. It's just for us to understand the basics of blood pressure. So that's what we mean, So, and usually, if the blood pressure, so there are certain processes in the body or certain activities that we may engage in that can cause the blood pressure to go up temporarily and then it will come down again. And then sometimes certain things we do can also make our pressure to be lower than the normal range, but to come back up. And so usually the problem is if the blood pressure, so when we say for somebody to get a diagnosis of hypertension, that's when the blood pressure is high and it stays high. It doesn't come down except with some help like medication. So we usually want to avoid that because ordinarily high blood pressure causes damage to a lot of many parts of the body, to practically all parts of the body. It's not good. It's not good for the blood pressure to be too high, because over time, even the vessels that transmit blood from the heart to the different parts of the body, which you call arteries, can get damaged. The veins can get damaged. The heart itself also will get damaged, and usually the bad effects of blood pressure doesn't cause any symptoms until like there are major complications. So that's why high blood pressure, which is also known as hypertension, is called the silent killer, because it damages different parts of the body, including the kidneys as well. It can damage the kidney, the liver. It can also cause problems in the brain, in the eyes, and these effects don't show up until major complications occur. So that's why the blood pressure is monitored, regularly. For most people, is encouraged at least once a year, but of course, every time we have contacts with with healthcare system, our blood pressure is checked. That's why it's called a vital sign. So vital, the word vital comes from life. So it's a sign. So the blood pressure is a sign of life. So anytime before somebody can do anything to us, they have to check our blood pressure to make sure it's okay, because it may be high and we don't know, we don't feel it. So usually that's why we say it doesn't have any symptoms. So symptoms are things we feel. So like a headache, or the eyes are hurting. Yeah. So we don't wait for symptoms in order to take care of high blood pressure. We have to take care of it because it's damaging a lot of things in the body without our knowing it. So, but usually the diagnosis of hypertension is not made with one-time measurement. It's something that, let's say if today you go to your doctor's office and they find out that your blood pressure is high, they are gonna most likely check it again before you leave the office. They may ask you if you have a monitor at home, and then you check it. They teach you how to check it, and then they'll follow up with you again. Like depending on the number. But sometimes also the diagnosis of hypertension can be made at like just with one measurement, depending on how high it is, or if it has already damaged or caused significant damage in the body. So sometimes, a diagnosis of hypertension can be made with a one-time measurement. It just depends on how high it is. But if it's not, if the elevation is not too much, if it's not a lot higher than the usual thing is that you'll be monitored over time, like 3 months, 6 months, and be encouraged to make some changes in your lifestyle, like things you eat, how much exercise you do, the things you drink. And then if after all that non-medication treatments, the blood pressure doesn't come down to normal, that's usually when a diagnosis will be made, and then you will likely be placed on medication. So we can talk more about that, and I would like you to know that eventually, um, I may I'm gonna have an office where I'm gonna be taking care of adult patients who want to make sure they're in good health all the time. So please come back to the channel uh, to keep to keep up to date, because when my office opens, I'll announce it on this channel, and then that and explain to you how you can become my patient if that's what you want. But for now, please keep following up with your primary care physician and make sure your blood pressure is being monitored and is within normal. And then yeah, I'll see you again the next video. So keep coming back to the channel for more information, and if you have questions, you can also put it in the comments, and I'll address those questions the next video. All right, take care now.